but you will also be protected. So this is going to be an additional cost.
The next person in line, your friend at school or your co-worker, may have COVID-19 and not know because they have no symptoms. You, on the other hand, could be hospitalized for 2 months or more if you become infected. Is it worth it? Stay socially connected, but keep the physical distance. Stay 6 feet away and avoid a hospital stay. COVID-19 is not over. Protect yourself while protecting others. A message from the Ministry of Health and Wellness.
Hello? How are you?
Ministry of Health and Wellness, Mr. Dunstan Bryan, and the Principal Medical Officer and National Epidemiologist, Dr. Webster. We also have with us Mr. Louis Barton, is the President of the Jamaica Association of Taxi Owners and Operators, and Mr. Paul Abrahams, the Managing Director of the JUTC. We'll begin the COVID-19 conversations with the opening remarks by Minister Tufton.
Thank you very much, Stephen. Good evening, ladies and gentlemen. Welcome to the regular Thursday evening COVID conversations. Just removing my mask for clarity. Very happy to have you online and on board. And we have a lot to discuss, a lot to report on this evening, which hopefully will represent an update on a number of things that we have been doing. A short but very busy week. The team has been in the field working hard to address the community spread or that we have been encountering. And so far, I think they have been doing a fairly good job. We continue to appeal to the public to respond to the advisories, to the orders that are out there, and we will give some updates as it relates to the challenges that we face and how we're going about dealing with those challenges. Before we get into the updates, I'm going to ask our Chief Epidemiologist, Dr. Webster, who is also acting as CMO, given the time off that has been allowed to our current CMO, well deserved, to just give a quick update on the numbers, and then we go into updates on other areas, and then from there we go into our main look for the evening, which is public transport in the context of community transmission. The issue now is, what are the risks associated with public transport? What are we doing to minimize the risks? There are some things in the orders, but there are other things that I know public transport operators are doing or should be doing. And I think it requires a conversation to keep the public informed so that they can take their own precautions. So firstly, Dr. Webster.
Thank you, Minister. Good evening. The numbers as of today or last night is 8,600 confirmed cases, of which 1,094 were in the last 2 weeks. So this is what we call our epidemiological curve, and it shows that the highest point for one day for date of onset of symptoms of cases was on the 2nd of September. Last week I said August, but it should have been September. It was clarified during Minister's clarification, but I needed to make sure that was known. So understanding this curve, the next slide, would show what this is all about. So the blue line shows the moving average. So in general, it seems to be a slow, very slow decline. We had a sharp increase, which started around the 7th, 8th of August, when our reproductive rate was the highest at 2.5, highest in the recent times. Currently, our reproductive rate is fluctuated between 0.9 and 1. So 1 is where each person transmit to one person on average. So it will keep the numbers at a steady number. So right now, the worst that case scenario is that red line that shows basically a plateau with a very slow decline in cases. So, but us being so high in the number of cases, if we should slip, we will slide, because it would cause probably an explosive increase in cases. So where we are now is well above where we were in July. So this current slide shows what we call the positivity rate. What percentage of the tests have been done, that were done, were positive. We increased up to 24.4, that was our highest, and right now we're showing a very nice decline. However, we would want it below 5%. So we need to improve our testing, which will improve to make sure we are testing enough persons. So that is part of our process. The number of days between each 1,000 cases was area of conversation last week. So what I've added is the number of days between onset of symptoms. So pretty much show the same thing. The only thing is that when we do tests, we put it in the date of onset. But the date of confirmation and the date of onset, there's a 2 weeks delay. So what I need to show you today is that the positive, in the previous slide, it is taking us longer to get to the 1,000 case in days, but it's also taking more tests to give the same amount of number of positive cases. So it's not just the days, but the number of tests that you need to do to get to that 1,000. So just for expansion in today's presentation. These are the rates for the parishes, which shows that the parishes of Kingston, St. Andrew, St. Thomas, and St. James has the highest cumulative rates, but for active cases, St. James, Kingston, St. Andrew, and St. Catherine has the highest. When we look at the parishes, Westmoreland, St. Mary, and Kingston and St. Andrew not looking very good. There's no parish that has seen a decline over the 3-week period that we looked at. And so we're hoping to see some green soon in this chart as we go forward. So we have reviewed the questions that are being asked online, and these are common ones related to the transmission. Just to say, community transmission is a term referring to countries with large number of cases which are not linked and may involve numerous communities. So persons asking, so I don't know anybody with COVID, but you say we have community spread. Probably many persons there are asymptomatic or mildly symptomatic and never been confirmed to have COVID. And some are saying, how effective is contact tracing in this sort of environment? It has become more difficult, but we have to prioritize. And how do I know my community have cases, and how are they increasing? So we track it, and we will provide the information periodically. The next slide shows what we do. This is the communities. And next slide. So these are our top 20 communities. In the general Montego Bay, Greater Montego Bay development area and downtown are featured highly in the top 20. So in relation to deaths, a COVID-related death is a death confirmed in a person who is confirmed to have COVID-19 that have conditions in keeping with the possible effects of COVID on the body. A coincidental death is a confirmed COVID-19 cases for which the cause of death cannot be related to COVID-19. Example, we have had gunshot wounds, we have motor vehicle crashes, and the person died, but coincidentally or incidentally, they have had COVID. For persons under investigation, these are persons who we don't have enough information at the time to put them in. So, with respect to deaths, the blue line shows the date of onset of the cases for the persons who died, and that peaked the week after the peak of cases. However, we are noticing that the persons die a week after that, and last week was not a very good week for cases. Males are more likely to die from COVID than females, and when we look at the age group in the next slide, as you get older, you are more likely to die from COVID-19. Next, this is just to show that most of our cases who have died have had comorbidity or are over 60 years old. Persons who stay in hospital, they die between same day of arrival to 46 days with an average of 10. We have had 6 persons who were dead on arrival to hospital. And the parishes with the greatest case fatality rate are Westmoreland, St. Elizabeth, St. Mary. And when we look at the deaths per population, we have St. Catherine, St. James, Manchester, and St. Elizabeth. And I think that is it for the presentation, understanding the numbers. Thank you.
Thank you very much, Dr. Webster Kerr, our Chief Epidemiologist. Dr. Webster Kerr, what jumps out at me, which I think deserves some highlighting, is that you are still cautiously optimistic with the rate of spread based on the numbers that you're seeing coming from the number of tests. You're saying that we have to do more tests to get the same number of positives, which means that the proportional number that are positive are less, and that you are therefore seeing the curve on a gradual decline. But you say, I say cautiously optimistic because you're also saying that if we deviate from the programs that we're pursuing, which is do it with the interventions, getting Jamaicans to comply with the restrictions, the wearing of masks and other things, then you could see a surge, another surge.
Right, and you're starting at a higher.
And you're starting at a higher level, and therefore meaning it could be worse than the one before.
Exactly.
And I think that's a very important point to make, because what it's saying is that we're still in the midst of this response. There are still significant risks associated with our actions, with our decisions, and therefore, from a public health perspective, it's important that persons interpret the numbers and the movement in trends as encouraging, but not so encouraging that we think that we have finally come out of the woods, because we're not. We're still managing each day. And you would have seen manifestations of that with the quarantining of communities, with the intervention that had to take place at the Golden Age Home and other such places. But thanks a lot for that, and we'll continue to give an update on where we are each Thursday, and we will provide the slides that have been presented on our website. And I'm going to ask too that we put those up on other rights so that Jamaicans can see what is happening. I want to also use the opportunity to commend those persons who came online through our Zoom meeting of community leaders over the last week. I had a number of Zoom meetings for community leaders at the parish level. And I think all told, we spoke to probably 400 to 500 community leaders. These are youth leaders, you know, the Custuses, the JPs, the service club presidents. We also had the launch of our youth response forum at the Jamaica Conference Center. We had some 20 or so organizations at the center itself, at the location, appropriately distanced, of course. And online, we had another 70 or so entities across the country. Very good discussion. I mean, very impressed with the leaders who came on and the youth leaders who came on. And there's a commitment to engage the process. So that represented the start of the process for the mental health response. We will be uploading a form online soon for persons to fill out and submit. We will engage in a further training online, and then those persons, depending on where you are in your community, will be given or assigned to the public health team at that localized level, whether at their health center or otherwise, to provide some guidance and support as we reach out to support those with mental health issues, with loneliness issues, with depression issues, with basic supporting or coping mechanisms. And similarly so with the youth, who will help us to carry the message of COVID and to be a part of the solution. Today I met with the Jamaica Chamber of Commerce executive online, Mr. Lloyd, President Lloyd Dunstan and his executive, including parish chapter presidents or parish chapter heads. A good discussion there. And again, they have committed to being a part of raising the awareness, pushing the protocols at the level of their membership. And we then toured 2 facilities in Kingston, Courts in Crossroads, and Amar's clothing store in Halfway Tree, just to see what they have in their locations. The chamber is committed to doing more, and I was very pleased with the reception and the conversation. And this is really what we want. I mean, the COVID response has to be everybody's business. We have to all see an interest in doing this, and I think so far it is encouraging that we are all recognizing the importance of coming on board. I want to give an update on the Golden Age home in Vineyard Town. A few updates actually, starting with this one. So a team from the KSA Health Department and the Southeast Regional Health Authority visited the facility on October 21st and 22nd. During the visit, the following was done. Public health inspectors inspected all clusters and provided guidance, re-cleaning and sanitizing, and the placement of cases and persons in quarantine. Residents that were confirmed positive were assessed and found to be in stable condition. So all of the other positive cases remain asymptomatic, which is very encouraging, and we'll continue to monitor that. Instructions were given how to clean and sanitize at regular intervals. So we went through the process again to reiterate, to reinforce the protocol around cleaning and sanitization. A meeting was also held with the matron of the facility and some of the caregivers, and they were advised to assign staff to specific clusters as opposed to moving from one cluster to the next. And so that would have been a change. Maintain quarantine of exposed residents. And health education officers interacted with staff and residents to assess knowledge, attitudes, and practices towards COVID-19. And that assessment continues. 564 persons have been sampled to date. We did say in our initial press briefing that we would provide testing for all. Of the results received today, October 22nd, 2020, for samples taken at the Golden Age home, yesterday, 26 were positive. So we have had 26 new positives, which brings the total number of positives to 69. And the breakdown of that 69 are as follows: 19 staff members, 40 residents, and 10, I'm told, to be determined. So 10 is being sorted out to be determined whether it's a staff or a resident or otherwise. So 19 staff and 40 residents, 10 to be determined, total of 69 positives of the 564 tested. Over the next few weeks, the health team will continue to support the staff, the home with the monitoring of the health status of the residents, train in infection prevention and control practices and procedures, and provide clinical support to any resident or staff who may become moderately or severely ill. The ministry again wishes to assure the public, as well as families and friends of staff and residents, that all the necessary measures are being implemented to ensure the best possible health outcome for this outbreak. And so we continue to monitor and to manage the process at the Golden Age Home. I think we are very happy that no one has fallen victim in its extreme so far, but we do have 69 positive cases, and so we have recommended a few changes and provided some additional training to try and avoid a reoccurrence of this particular issue. And we will continue to keep the public informed. Update on the special quarantine zones. So let me look firstly at the two special quarantine communities, Whitfield Town in St. Andrew and Waterford in St. Catherine. In Whitfield Town, the measures implemented were as follows: increasing curfew hours from 6 p.m. to 5 a.m., limit the number of persons at public gatherings to 6, stricter enforcement of measures outlined in the Disaster Risk Management Act, and increased presence of members of the JDF and the JCF, enhanced surveillance, health education and health promotion, vector control measures, and inspection of businesses. I visited both communities and observed for myself the team at work. I want to recognize them and commend them for the efforts on the ground. I went into both areas with the political representatives, the members of parliament, the councillors, and indeed there was an attempt I could discern of the citizens to try to improve their infection prevention and control measures. And I think that's part of the purpose of the quarantining of these communities once we see a trend that needs to be discouraged. The measures were put in place for 14 days, as announced by the Prime Minister, and after some 8 active cases were noted in the community as of September 29th. At the end of the 2 weeks, we have taken 236 samples, including from 5 persons who were symptomatic. 20 samples have so far returned a positive result. So we have seen 20 samples return a positive result, giving us a positivity rate of 9.7%. 30 samples are awaiting results. We also distributed 1,744 masks, 3,882 information, education, and communication brochures, and inspected 51 businesses and 2 churches. So the team has really been active across the district, the community, educating, communicating, distributing masks, looking at businesses, and of course collecting samples and testing. Important findings from our efforts include that community members perceive themselves to be at low risk of infection, and as a result did not wear masks at all times and did not observe social distancing. Some persons were also reluctant to get tested. So our observations reveal that we still have a long way to go in convincing all Jamaicans to wear the masks, and we have seen evidence of many in this instance not taking it as importantly as they should, being very casual about it, as well as the observance of social distancing, and in some cases testing. There's still some stigma around testing, which we have to work on to overcome. At the same time, I want to report that over those 2 weeks, more persons did in fact buy into wearing masks and wearing it correctly. Less persons were gathering in public and instead staying at home. Some businesses had made available hand sanitizers for staff and patrons to use on entering, while others had set buckets with faucets to serve as hand washing stations at their entrance. In fact, I saw a house that had a makeshift sign that said before you enter that particular residential dwelling, you needed to sanitize, and there was a little canister of water with a little thing with spray soap. And, you know, persons have been very creative. Also, several businesses have erected signs to wear masks, while those without masks were denied entry. The team also noted that the number of positive cases yielded from testing decreased over the period they were inside the community, with samples taken on October 16 and 18, for example, yielding only one positive result for each day. So as we move through, as we identify through contact tracing the persons who are closely associated with the positive cases and move further out in the search or the examination, we found less cases, and therefore it's an indication that we have managed to, I think, break the back of the surge in that particular community, and that's exactly why we intervene, to go in and to cauterize the problem. Sorry. In Waterford, an initial assessment of the community was done on October 4th to determine the need for further intervention, including testing. 63 samples were taken, and 15 of which returned positive results. Similar activities to those undertaken in Whitfield Town were undertaken in Waterford. After 2 weeks, 2,446 homes were visited, including a few repeat visits, and 197 persons were tested. A total of 20 persons tested positive. 11 of 33 nursing homes on records were visited during the period of the special quarantine. There were 3 active cases from 2 nursing homes in the Waterford area at the start of the community COVID-19 surveillance, and this prompted the decision to test all nursing homes. As we would already be testing in Waterford, we used the opportunity to test all nursing homes within the area of Waterford, Bridgefort, Independence City, and Gregory Park. A total of 39 staff and 187 residents were tested, with results received thus far being negative. All except one was passed as satisfactory by the Public Health Inspectorate. This is an issue. I mean, we're being very transparent about it. But this particular area, the Portmore, Waterford, Bridgeport, Independence City, Gregory Park area, has a number of nursing homes, facilities, and given the challenges we uncovered in the case of 1 or 2 of these facilities, we took the opportunity to deal with all, to test all. And, you know, again, there are a number of these facilities that are not up to par in terms of the infection prevention control measures. Our public health officers continue to monitor, to engage, and where necessary, we will take action, because we do have the authority to shut these facilities down. There is a dilemma, though, because when you shut down, the question is, where do you place these persons? But if the situation is intolerable and the residents are at risks, then we will have no option but so to do and find alternative arrangements. And I want to issue a caution, a warning to operators of nursing homes. Please follow the protocol. Put the systems in place, because you're putting your livelihood as private operators and the lives of residents and your staff at risk by ignoring those very important protocols. And we will shut you down if we think that you are ignoring putting those protocols, those measures in place. I want to turn to an area that we have not commented on publicly to date, but has taken place over the last few days, and I think it's important to make it known. This involves the mustard seed community. The St. Catherine Health Department started surveillance at the mustard seed community after receiving a positive result for a staff member based on the physical, medical, and psychological challenges of the persons under their care. This is at the Mustard Seed community. A decision was made to test all staff, initially to determine if there was a need to test further. Of the 111 staff tested, 16 persons were positive. The health department has now completed testing at Mustard Seed. The 111 staff and 148 residents were tested, in addition to the 16 staff members who have returned a positive result. 20 residents also tested positive. All staff have been placed on home quarantine and the necessary contact tracing done. The residents have been isolated on site and 3 staff assigned to care for them. 3 areas have been identified on site for appropriate isolation, quarantine, isolation of asymptomatic positives, quarantining of symptomatic negatives, and isolation of symptomatic positives. Appropriate personal protective equipment are being provided by the health department as necessary, and 1 medical officer will monitor the home with daily updates from management. So this has been happening over the past week at the Mustard Seed community. For those who don't know, the Mustard Seed community is a very important institution in Kingston that looks after the disabled who have no means to look after themselves. And it represents a vulnerable community by virtue of the residents who are there, and we therefore acted out of an abundance of caution, and it was the right thing to do based on the surveillance and the 1 individual that had an issue. And the result of the full testing has been an intervention on the part of public health, leading to isolation, quarantining, and support, additional support by the health team and protective gear to overcome the challenges there. We will keep the public updated as we go along. Up to this point, I don't think anyone is critically ill, so that's positive, and it's just to provide additional support and at the same time assess the protocols of engagement at the facility to strengthen those protocols. In terms of the staff welfare program, a couple of weeks ago, we announced the introduction of a staff welfare program for which the total cost of implementation was $37.9 million over 12 months. The program is now underway with an initial offering of opportunities for rest and relaxation at a local hotel for team members, at a local hotel, and similar opportunities to follow in the coming weeks. We have also now designating testing sites for the offer of prioritized sampling for public health workers. There are a total of 42 such sites, 15 in Southern Health Region, 13 in the Southeast Health Region, 11 in the Western Health Region, and 3 in the Northeast Health Region. So these sites will give our staff members an opportunity to test on requirement and will give them priority. And we have begun the process of giving them access to a North Coast facility for rest and relaxation, and they're allowed a certain number of days at a very, very, very minimal cost, extremely minimal, and there are a range of activities that will give them support there. There are other measures that are going to be unveiled over time. Some are already in place, like the additional payment for the work that they do, and we will make that public over time. In terms of transportation and COVID-19, which is the final update, I did say we had a lot of updates today, which will take us into our interview with Mr. Paul Abrams, Managing Director of the JUTC. There are challenges as it relates to public transport, and challenges as it relates to the risks associated with congregating in a confined space, the multiple persons moving in and out, and those risks are real, and we have to accept them for what they are, but they are necessary because people have to move about, and not everybody have their own private locomotive to move from one place to the next. So in our efforts to slow the transmission, there are two very important group of stakeholders that I think we have to engage, and those are our transport operators and commuters. And the analysis of the data from our contact tracing efforts have revealed that persons traveling in the same vehicle are 3.5 times more likely to be infected with COVID-19 and become ill than household members. And this is based on the number of positives we've had and the contact tracing that we have done so far. There's more data that I think will help us that we want to make public. On average, some 200,000 Jamaicans utilize the public transportation services of the JUTC daily. There are 40,000 registered carriers across the island and an estimated 20 to 30,000 others who are unregistered. Some 80 persons, as I understand it, are transported per day by 80 persons, sorry, not 80,000, 80 persons transported per day by a single taxi driver. And this is data that confirms that there's interaction and there is commingling, if you will, within a fairly confined space. It means, ladies and gentlemen, that of the necessity we must exercise extreme caution in our daily travels, abiding by the stipulations of appropriate infection prevention and control. And in particular, we say to persons, you must allow to carry under the relevant license or by bus be limited to seated passengers only. The order does say one less from what the license allows you to carry, so you create space. Drivers and passengers must wear a mask at all times. I have been in Halfway Tree Square and in other squares around the country, town centers, where I've been giving out masks, and I must say a number of persons comply, a number of persons don't comply. And so there's the possibility of spread. As simple as that. So we want to encourage that. Vehicles to be operated with windows open and air conditioning turned off. That is not always observed, but it is generally observed, so that you have free flow of air, and that a vehicle transport one person less, as I said earlier, than the maximum number. So it is a real challenge. It does require some adjustment. There are concerns about revenues and whether you're going to be able to collect more or less revenue. So all of those combined, however, are important to balance with the public health risks that we take. So to help us understand what's happening at the JUTC, we have asked the managing director, Mr. Paul Abrahams, to come online. Mr. Abrahams, how are you, sir?
Good evening, Minister, and good evening to your panel.
Thank you very much for coming on. Wanted to ask you, Paul, about the public transport system and JUTC in particular, which is your primary responsibility. In light of COVID, how are you coping? And I'm asking from the perspective of both your operators as well as the passengers. I mean, how do you monitor that, and how is it unfolding?
I think as far back as January, we started an educational program in the JUTC to alert our staff of the pending COVID-19, and also to how to protect themselves and protect their families. And as you said prior, JUTC at that point carried significant amount of passengers. So we basically were, you could classify as one of the high-risk entities. Having 150,000 persons on your buses every day and not knowing anything about them definitely classified us as a high risk. In March, we established a command center, and that command center was to keep an eye there on our PPE supplies to ensure that we had sufficient supplies in event COVID did break out, which it did. We were able to monitor our staff to see if any cases came in, and of course, as I said, we were very exposed at that point as a public passenger system. We have installed temperature checks at all our facilities. So every employee that enters the gate is his temperature is checked and logged. We have also sanitized buses at each depot. A bus comes off of a trip, it immediately is sanitized. When it comes back into the depot in the night after its last trip, it's sanitized. All the major hubs and laybys are sanitized a number of times at every trip. Every 15-20 minutes, we do the sanitization on the high-touch areas. Half of the transport center or equipment and sanitization equipment is there for our passengers to be used. It's an ongoing process. The buildings, the facilities are sanitized twice per week, but depending on the situation that we had in the corporate office in which we had some positive cases. That point we had up to 35 positive cases, and we had 142 persons in self-isolation. I can say right now we have one positive case list, and all persons, 141 persons have returned back to work at this point. We observe social distancing in all locations. And of course, the order says that we are seating passengers only, which is difficult on our revenue, but we understand the situation, and something, like that is important. The area behind the driver's seat has been removed or chained off so that he's not in any interaction with the driver. And as the days go by and as the time go by, we monitor the situation, and we do our best to ensure that the safety of the commuters and our staff is paramount. But it is a fluid situation which we monitor day by day.
It sounds like you've put some the protocols in place, which is commendable. The operationalization of the protocols, though, particularly as it relates to the passengers. How does a driver on a bus relate to a passenger who decides to be a passenger from hell? That's what, in sales terms, that's what they call the most bad behaving passenger, who decides to come on and not wear the mask, to talk loud, to get boisterous. Maybe they had a little drinks prior to coming on the bus. What happens in a case like that? That should be a tense environment. How do you deal with that?
It becomes a very tense environment, because you have another 20 odd passengers that would like the bus to move, and the driver is instructed that he's not to move, and that person is to step off the bus, and it becomes a very, very tense situation, and it really becomes the driver himself to try and resolve it as peaceful as possible. We have point dispatchers that are at locations. But as you said, yes, it's a very tense situation, and we try to talk to the customers and explain the sensitivity of the issue and the matter. And it's important to understand and explain to them it's for your safety also, not only for other persons. And it is difficult, but we have to manage it. And like many other things, we have to manage it on our feet.
Right. Do you have signage on the buses and at the stop points, so that when a person enters a bus, he sees signage around the protocols and why it's important, that sort of thing?
Well, the signage is there, but the driver is instructed to advise them that there's no entry unless there is a mask. That's the first thing. Mm-hmm. And the second thing is that it's seated only. In times when you have a curfew, or a time frame in which the last run is leaving at 7 o'clock to get into the depot before the 8 o'clock curfew, you find that a lot of commuters who have not managed their time properly will crowd the bus at a center. So it's extremely difficult at that point to turn away commuters from the bus. Mm-hmm. So that does get itself a tense situation also. But the drivers are instructed that masks are mandatory, and you cannot come on the bus unless it's mandatory.
Mm-hmm. And
unless you wear a mask.
You find that more people are complying than are not, or is it the other way around? What's the general?
I say we have good compliance. I would say we have quite a good compliance. There are the persons that as you said earlier, are difficult to manage and believe that it's not, it's not important and it's not a risk. But I would say our compliance is high, and persons are complying. I must say that.
Okay. Well, Paul, thank you very much for coming on. It's quite clear that our bus drivers are part of our frontline workers as part of the frontline response. What you're saying basically is that they are key to providing information, to helping to coordinate the protocols, to dealing with those who are refusing to, and just to provide basic information, which places them right in the middle of the COVID response. So I want to salute our bus drivers, our JUTC drivers, and other drivers of public transport, because it really becomes their rules of engagement that determines exactly what happens in public transport, and the extent to which they take on their responsibilities seriously is the extent to which I think we can get some of those protocols implemented in the public space. So thank you very much, and the Ministry of Health will continue to work with the JUTC, with yourself, to advance the process. Thanks a lot.
Yeah, man. Take care.
All right, we now have, or should have, do we have him online? The taxi drivers, Jamaica Association of Taxi Owners and Operators, Mr. Barton. Okay, he's on. Mr. Barton, President of JUTC. How are you, sir?
I'm okay, Minister. I am okay. I have not had the virus as yet. I hope not to.
Okay.
Can I say the same thing about transport operators, totally, about the entire sector? But before I go on, I just want to thank you for this meeting, or this ability to talk to you or to the officials about our condition, because I have been asking for such a meeting from before COVID became popular. It's a popular thing now. Right. So it really gives us a chance to give some direction.
Well, I want to start. First of all, thank you for coming on, Mr. Barton. And we're most interested to focus, because I know there must be many issues, but the public health perspective. I mean, I must tell you the truth, and I believe there are many very good and obedient taxi drivers out there. I've seen many of them. And I appreciate the service they provide, the work they do. But the reputation of taxi drivers in the corporate area is not that great, generally speaking, in terms of the overtaking and the sort of mad rush to move from one point to the next. And, the numbers in the vehicles and the switching lanes and so on. I'm not going to take you on with all of that conversation. I want to look at the public health perspectives, and just tell me, how have you done as an association in trying to get your members to comply in their interests, as well as in the interests clearly of the people that they serve?
Well, we have been trying to do our little part, and literally in the sense that JUTC we have about less than 200 direct members,
okay.
People who can count on to get active, to do something at any one point. But we have an influence throughout Jamaica, right? Not only, my association deals with Hackney carriage, particularly in Kingston and St. Andrew and St. Catherine. But we have operators, we have members, active members, who travels from Kingston to Westmoreland, to Montego Bay, to Ocho to Port Antonio. So we have a wide perspective. But just let me give you a kind of overview of what the transport sector is all about. We are saying that we have about 35,000 registered transport operators, registered licensed by the Transport Authority. Now, each of those, on the average, each of those operators, taxi operators in particular, carries about 80 passengers, 80 contacts, because it's not 80 different passengers, because they might take a person to work and you take them back, right? But it's 80 different contacts per day, right? Now, our estimate that is over 2 million contacts per day. Now, when this COVID thing came to light, we tried to get the different, some ministries, some other associations the Transport Authority to give us an idea of how you're going to deal with this thing. Nothing was forthcoming. We got what we asked for is that they clean up. They sent a truck out, I think it's a KCAMC, sent a truck out to clean up half a tree. I remember seeing on TV that they sprayed. And I was there when they were washing the place. So that is one thing. They did the same thing in Montego Bay, right? And I think there's another major town, either Maypen or Santa Cruz, I'm not quite sure. So at the beginning, we were expecting that to continue. It didn't. So transport operators start to wonder, is this COVID thing as real as they say it is? And I'm not doubting it, but it gives you the impression that something is not as straight as it is. We don't know how many transport operators have contracted this disease. We don't know how many have passed it on. And one of the things that I want to call on the administration this evening is to probably give us some statistics by occupation. How many drivers, how many passengers, how many whatever, just by occupation, so that we can protect ourselves, right? Now, as far as protecting ourselves as in a small business, we have sanitized vehicle. We wear the mask. I just took off my mask because I'm on this thing now. Some of us wear the shield, and some of us even sanitize after each trip. Now, so those are the good part. The bad part is that there are many of us who are not obeying the rules, who are not carrying out the recommendations by the Transport Authority or by the Ministry of Health. Now, the problem is, how do you get these people to comply? We as an association can only appeal to our members to do the right thing. But our members don't, some of our members will follow us, some will just dismiss us. But there's no punishment. Talking about a big stick over your head or anything like that. But there's no negative reward for not doing what is necessary. So we are in a limbo right now. We don't know what's the next step. We would be hoping that that the ministry would be able to give us some guidelines as far as how it is, what is to be done. And as far as the guidelines is concerned, as I said before, we were asking for something earlier in the year. We are on a regular basis.
So
can be updated.
You have said a number of very important things, Mr. Barton. First of all, you have correctly pointed out the extent to which you expose, or your members or taxi drivers generally are exposed to the public, and how much the public is exposed to the taxi driver. Both the individual behind the wheels, but also the vehicle, the taxi, the car, and that's definitely a point at which we have to find a way to make sure that we encourage safety, certainly in the COVID response in that public transport space, and to the extent that someone like you is uncertain about what can be done, what else to allow for greater compliance, is for us concerning enough to say we probably need to have some kind of conversation. I certainly intend to dialogue with the minister with response for transport, Minister Montague, who I know is a very hardworking minister, and he has done a lot for public transport and taxi drivers. I will have a dialogue with him and see to what extent we can collaborate to have a sit down to see if we can bring clarity and encouragement to taxi drivers and those who use the taxis to play a greater role in the COVID response. Because we need that kind of collaboration. There's no ands, ifs, or buts about it. The other thing that you have spoken about is the whole issue of enforcement. And there is enforcement, but we are bringing some clarity to that. The Ministry of Justice and AG's office are working on more specific fines, penalties for persons who breach the mask wearing and so on. So that is something we can have a conversation on. And the third is the protocols around driving. You have listed 3 very important issues. You spoke about the mask wearing, the shield wearing, and the sanitization of the vehicle after every trip. I think, but you made that last point as if some of us do it. It really should be a standard feature of the COVID era. And maybe that again is going to require some conversation as to what's the best approach to dealing with it. So what would your advice be to all of us, both to government but also to your members and to passengers from a public health perspective in moving the process forward and creating a safer space?
Mr. Minister, what I would like to see right now is more information passed on to the different associations island-wide. Because in Jamaica, we have at least 35 different transport associations for the 35,000 operators. If you have the associations getting the proper information and being required to pass it on to their members, then that will be a step in the right direction. But that those associations need to get the required, the necessary information to pass on. And that is one of the ways that you would help in the policing of the misbehaved transport operators. So there are many things that can be done and can be suggested, but as far as the technical thing is concerned, health-wise, I can't tell you what can be done. Off the top of my head now, I can't say that. But I think we need more contact, more of this type of dialogue with you or the health experts on a regular basis until this thing is over.
Okay, well, I think that's good advice and good note on which to end and to make a commitment to continue the dialogue. So we appreciate that. Again, we see taxi drivers as an important part of economic activity and an important interface with the general populace. And so they are also part of the front line of the COVID response. So we will work with you and we'll work with our Minister of Transport to try and find some solutions to some of those concerns and challenges. Thank you very much, sir. Have a good evening.
All right, thank you, Mr.
Okay. All right, and finally, we should have now online a testimonial from Miss Tushana Forbes, who is a JUTC bus driver. And is she on? Hi, Miss Forbes? No, not yet. You're working on that? Okay. I think the discussions so far are interesting, and from the JUTC and the Taxi Drivers Association, or JATU. Let's hear now from someone who is actually out there on the front line as a driver. Tushana Forbes. Ms. Forbes, are you on? Ms. Forbes?
Yes, I'm here. Good night.
Oh, hi. How are you?
I'm good. How are you?
I'm fine. So tell me now, you're a bus driver. You know, that's a big job there for a lady doing, all right? I always admire seeing our ladies behind that wheel and moving through and carrying the many Jamaicans who depend on movement. What area do you apply? What route?
Currently on the 47 route.
All right, I'm not sure what that means, but the
47 flies from Chancery Street to Malines Road, halfway tree.
Oh, okay.
Linders Road, 301 Boulevard to downtown.
All right, sounds good. And you work on shift, right? So you work sometimes early, sometimes late. Is that how it works?
No, I'm currently on the morning shift.
Okay. So what time that starts? Just after curfew, 5 o'clock?
Starts at 5:55 and ends at 12:36.
Okay, great. So tell me a little about the challenges of operating in the COVID environment and enforcing the protocols on your bus. I heard from Mr. Abrams that it is a real challenge, and in a sense, you have to be the coordinator and overseer of this process. Tell me a little about it.
Well, it's a bit challenging and scary at times, due to the fact that we don't know who is the carrier of this COVID-19 what you either refer to as a disease or
Virus?
exactly virus. Yes. So one of the challenges that we are facing on a day-to-day basis is the mere fact that some of the commuters refuse to wear masks, and if they actually do wear a mask upon paying their fare and having a seat, they normally take them off. Yes, so what I would normally do, I would ensure that the passengers are wearing their masks properly, meaning that their nose and mouth are covered properly. Yes, and there are times when passengers would raise an alarm as to why some of the commuters are not wearing a mask, and you know, it would send. I would get up and just ask the commuters that are not wearing it to put it on.
So you stay in your little cubicle and speak on a system, or you actually get up and stand in front of everybody and make those statements? How does that work?
Well, if I'm driving and I hear the passengers raise an alarm, I would pull over at the bus stop and ask them to put on their mask properly.
Do they
or if I'm stationary at my pickup point and I notice that they're not wearing their mask properly, I would beckon to them to, fix their masks on their faces.
And do you normally get compliance? Well, what percentage of time do you get compliance? How many of every 10 that you talk to, how many of them comply or follow your instructions?
I mean, about 80% sometimes.
Okay.
Yes, but some of them listen. They listen. Until you turn it back again, they take it off.
Boy, yeah, that's unfortunate. What do you do with those who don't comply? You follow the instructions of your entity that says no movement of the bus unless they comply or get off, right?
All right. If they're embarking the bus without a mask, ask them to stop before coming up. And please I ask them kindly please to put on their mask. And if they don't comply, I restrict them from entering the bus.
And they don't, and you're okay doing. You don't feel well. I'm told that you have dispatchers that can provide critical support at those points. So
Well, it depends. It depends, Minister, on where exactly on the road you are.
Right.
Because they are not always present along the route. So, I mean, I haven't had any issues where that is concerned. In the beginning, when this pandemic started, I got cursed, and I just asked them to step back. They're still cursing, sir, ma'am, please step back. They're still cursed. I can't do nothing about it. When if they step back far enough, I can close the door and proceed.
Yeah. So tell me something, Louis. You Tashana, sorry. How do you feel personally? Because I mean, this is a big job. Just by maneuvering the bus for many hours is big enough, but to having to take that on, how do you feel in terms of your personal well-being, safety? You're exposed. I mean, how do you cope? That's really the point I'm trying to make in this circumstance.
Well, I try my best to keep my hands properly sanitized, and I do wear my mask. It's a requirement to wear my mask, and I try to maintain that 6 feet distance, right? And I mean, it's very challenging. As I said earlier, it's very scary because you don't know who has it, right? So I just make sure I, keep myself safe, and as well as the passengers, I try to keep them safe as well by encouraging them to wear their mask. And there are dispensers at the front of the bus that whenever the passengers comes up or comes in inside of the bus, they can sanitize their hands, or at certain intervals, there are customer service that are present to, you know, sanitize passengers' hands before they come inside of the bus.
Mm-hmm.
So just trying to put my best forward and protect myself.
You have family, you have children, or?
Yes, I do. I have child.
Okay, so you have to work, you have to take care of your family, and you have to manage the risk. And sounds as if you're doing just that. So I really want to just extend my thanks to you, Tashana Forbes, JUTC bus driver. I think just speaking to you highlights the challenges of the COVID response. You know, in your own context, in your own environment, and it should project to all of those listening, all of Jamaica, that our frontline workers are not just the healthcare workers. It's the people who deal with the public each day and have to become the purveyors or the influencers of best practices. And, you know, in a sense, you're a part of the public health response. So I really want to thank you and thank all of those you represented here this evening. And we will continue to provide whatever support we can. We know it's difficult, but it's for a good cause. It's really the interest of our citizens, and indeed yourself and your family. Thanks again.
You're welcome, Mr. Tufton.
Good. All right, so there you have it, listeners. The discussions, having given you the update, discussions around public transport. I think this is an area that we have to follow up on, Steve. I think our Minister of Transport should be a part of a conversation. I'll certainly speak with him and make that happen. I know he's very concerned. I know he has done a lot. I've seen some ads that he has put out promoting the COVID protocols and the response. And, you know, it would have been nice to have him on now, but I think we will do some additional work and get him on board so we can jointly show the coordinated response. But I want to thank those who came on from JUTC and from JATU, because it shows that we really do need an all-of-society approach to overcome the challenges of COVID. All right, we're going to go right into questions now. So back to you, Steve.
Thank you very much, Minister. Just reminding our colleagues on the Zoom to use the raise hand feature to ask questions to the panel. We're going to begin with Althea Saunders from Jamaica Observer.
Good evening. All right. There's something I'm trying to understand as it concerns the coincidental deaths. Is there a reason why they're being included in the tally of COVID-19 deaths if it is that it has been determined that X number of persons didn't actually die from complications of COVID, but something completely unrelated? And would we not be unnecessarily bumping up our death numbers when we include these persons?
Okay, thank you for that question. So they are not included in our numbers for COVID-related deaths. So the 179 cases that we had would not include the coincidental deaths. We have to account for everybody who had COVID or had COVID. So we have to have a way to remove them from the active. So they are no longer active because they have died. So we classify them as coincidental, but they are not included in our numbers.
Oh, thank you very much, Dr. Webster. We're going to go to Brittany Clark from Nationwide.
Okay. Hello, good evening, everyone. So I have two quick questions. The first one, given the information surrounding, of course, the Golden Age cluster, and of course, Minister Mackenzie's concerns of, the possibility of non-adherence to COVID-19 protocols, has the ministry now taken any additional measures to assess the conditions and COVID-19 protocols at other Golden Age homes across the island, especially given the vulnerability of the age group? And the second question, with regards to the same Golden Age cluster, are there rather the additional positive cases from the same cluster, or that's the dwelling that they live on? Is it from the same cluster on the compound or the property, or is it from additional clusters, which could then indicate that the virus has spread wider across the compound? Hope that was clear. Thank you.
On the issue of the assessment of other homes, I did say in the press briefing that the lessons learned from this particular facility would be extended through our public health officers to continue the inspection and the follow-up with the other homes. And in the statement that was read earlier, we did indicate that in the Portmore area, a number of old age home or golden age homes were in fact inspected and tests done. So yes, it's an ongoing exercise, and the reasons are obvious based on what has transpired here. And we've always said that it's something that we have to monitor on an ongoing basis. The second question, I think, may be better answered by Dr. Webster Kerr. Let me allow her to.
Okay, thank you. The Minister, today's results, we are still, so far as only staff members have been identified as positive. So the team is going through to identify. So far, only staff members have been positive. We have 10 persons that we are trying to identify where they're from. So we'll know further probably later tonight or tomorrow morning.
All right, thank you very much. We're going to go to Nadine Wilson Harris from the Gleaner.
Hi, good evening, everyone. Just want to clarify, I know that there are several mustard seed homes, well, facilities operated by mustard seed communities. Could you say whether the COVID-19 cases is across the various facilities, or it's just at one?
It's one facility. I think it's called Jerusalem. I think that's what it's called. Oh, what?
It's in St. Catherine.
It's in St. Catherine. What's the name of the facility? It's one facility. We'll check on the actual name. All right.
Thank you very much, Minister. I'm going to go to Emma Lewis.
Yes, good evening, everyone. I was going to ask about the mustard seed location because there are several, and Jerusalem is in St. Catherine, but
I think it's a.
Mm-hmm. Okay, and my other question is.
Okay, did you hear? I think it's a Jerusalem facility in St. Catherine.
Okay, all right, thanks. My other question is, are any of all the cases at mustard seed, are they all asymptomatic? And are any of the cases hospitalized? And I also had a question about the nursing homes in St. Catherine that you inspected. How many did you inspect and how many cases? I didn't quite get that. I must have missed it. So would you mind repeating that part?
The information is that there are no hospitalization to date at the mustard seed facility. It's an ongoing, unfolding matter, so hopefully we won't have the need to. What we have done, as I said earlier, is to divide the facility into clusters and use the facility as the isolation in clusters based on what is happening with those individuals. That's the mustard seed facility. As it relates to the nursing homes, there are 11 of 33 nursing homes on our records were visited during the period of the special quarantine. This is the Waterford now. There were 3 active cases from 2 nursing homes in the Waterford area at the start of the community intervention. This prompted a decision to test all nursing homes, and we ended up testing nursing homes in Waterford, Bridgeport, Independence City, and Gregory Park. Total of 39 staff and 187 residents were tested, with results received thus far being negative, and all except one was passed as satisfactory by that was the actual facility itself. So it's a number of them that were tested, 187 persons tested and 39 staff members in nursing homes across the communities of Waterford, Bridgeport, Independence City, and Gregory Park.
Thank you very much, Minister. We have 3 questions from Romardo Lyons of The Star. He's asking, have we already peaked in terms of the cases? And the second question, any information on the law to tax persons for not wearing masks? And the third question is, how does the minister respond to public figures with large followings denouncing mask wearing, the latest being Butcher Banton?
Let me ask the acting CMO to deal with the peak issue, because I think we just presented on that to show that we are gradually on the decline, but we need to be careful. So, you want to just elaborate on that?
Right. Thank you, Minister. So, we have had the highest number that we have had since the start of the outbreak on September 2nd. But we may have had the highest number, but we can have a plateau, and we have been plateauing for a little bit, but that can change at any moment. So yes, we have had the highest, but before this we had 2 other smaller peaks, and so peaking is not an end, and it doesn't tell you that we are out of the woods or anything. So so we have seen the highest that we have seen so far. Thank you.
Okay, I think the other question was about masks. Oh, well, the law is not to tax. The law is to encourage compliance in the first instance and to enforce compliance in the second instance. The rules of mask wearing are contained in the orders that we have put out, which requires mask wearing in public. There have been some uncertainty, if you will, or confusion around what the enforcement mechanisms are in terms of the penalties. And so the government recently agreed to review and be more specific on what those are. The Minister of Justice, Mr. Delroy Chuck, Minister Chuck, and the AG are putting that together, and we should have those out soon. But yes, we do have enforcement mechanisms under law for the mask wearing in public. As it relates to the public pronouncements by individuals, and in some instances popular individuals, popular personalities around not wearing masks, our position is very clear. The public health's position is that the masks wearing in public is useful. It is an important part of the response to COVID and to restricting the spread of the virus. This is a clinical position that is not only endorsed and supported and advanced by us here in Jamaica, but by most countries throughout the world. I would say all countries. I don't know of a country in the world that is preaching or suggesting otherwise. And certainly in terms of the multilaterals, the partners in public health, the World Health Organization, the Pan American Health Organization, all have advanced as a policy, encouraged, prescribed that mask wearing in public should be a practice that is the norm, not the exception. In the developed world, in the United States, I mean, it's all there. So, I mean, we're very confident that it is the right thing to do, and we certainly would encourage Jamaicans to comply, and this is why this is part of the law as contained in the orders. And we will continue to push that message, because we think it's the right thing so to do.
Thank you very much, Minister. That's all the questions that we have on Zoom from our media colleagues, so I turn to you for your closing remarks.
Let me thank all who have come on and participated in today's COVID conversations. I think we had a fairly productive engagement. We tried to start a little earlier, almost on time, and we will continue to make an effort to do that. And I think we've been able to complete within the hour and a half, which is good. We encourage persons to continue to tune in and to keep updated. Our commitment is to be transparent and to be open around this COVID response. It's been a long haul, and it will be a long haul, and we need all hands on deck. We need all persons participating. Today's conversations around public transport is important, and we'll continue that dialogue going forward. And the updates around institutions in particular and the need for vulnerable institutions to maintain the protocol is very, very important. So we continue to encourage that. In the week to come, we'll be pushing the volunteer system in terms of our young people, and that program will see further recruitment and training. Similarly so, volunteers for community leaders across the country as we seek to promote the messaging and give coping mechanism support to those who are most vulnerable at the community level. That will continue to play an important role. And the collaboration with the private sector to advance the COVID messaging will also be dominant. We will also be giving updates later this week on the testing arrangements. The training continues for private labs through PAHO. The antigen tests, we are on track to bring those into the country, and the upgrading of private entities to offer both the PCR and antigen testing, which will address some of the concerns that I know the public has. So, ladies and gentlemen, thank the Permanent Secretary who is here, who did not say much today, but continues to be critical to the process. Our Chief Epidemiologist, Dr. Webster Kerr, Stephen from PR, and the team who are here, Phase 3, who continue to be loyal and faithful in providing the technology support. We appreciate the support. Keep safe. Remember now, keep COVID in the top of your minds as you respond to the concerns. And Tony, thank you again for being here, and congrats again on your award. Thank you very much. God bless.
Coronavirus is in Jamaica.
This is Iroy. Iroy is a born Jamaican.
Wagwan!